This is the coronavirus morning report for Wednesday, April 1st. The administration says the U.S. is facing as many as 240,000 deaths. Bad numbers to watch for from Indiana and Louisiana. Shocking stories from a U.S. aircraft carrier. And about Pentagon supplies that have nowhere to go. Why is COVID-19 so lethal for seniors? Why does Mexico have so few cases, at least thus far? And increasing questions about the true number of deaths in China. You might have heard that in the press conference yesterday, President Trump and U.S. officials gave estimates that they are expecting the death toll in the U.S. to maybe reach 100 to 240,000 people before this is all said and done. I don't know if there's anything more important to come to terms with than that. Dr. Anthony Fauci said the hope is that that number will be much lower, but people need to be prepared for the worst. Quote, "We don't accept that number, that's what it's going to be. We're going to be doing everything we can to get it even significantly below that. So, I don't want it to be a mixed message," he said. "This is the thing that we need to anticipate. But that doesn't mean that that's what we're going to accept. We want to do much, much better than that," end quote. U.S. fatalities topped 800 in the 24-hour period yesterday. I'm going to start off with this summary from the New York Times. Quote, "We are facing a global health crisis unlike any in the 75-year history of the United Nations, one that is killing people, spreading human suffering, and upending people's lives," the United Nations declared in a report calling for global solidarity in the fight. "This is much more than a health crisis," the report added. "The coronavirus is attacking societies at their core," end quote. With more than 30,000 dead across Europe, and the virus still spreading ferociously, millions across the continent resign themselves to hunkering down for weeks more and possibly months. Britain, France, and Spain all experienced their highest death tolls on Tuesday, end quote. Should be noted that while Spain's case numbers have exceeded 100,000, and they had a record number of deaths yesterday, the rate of the growth of the death numbers in Spain was less than 11% yesterday, which is down from a growth rate of 20% last week. So the growth numbers there are slowing in terms of number of deaths. At the beginning of March, there was only one detected case of coronavirus in New York City. There are now more than 40,000, along with 1,096 deaths at the time of this writing. The state of Indiana revised its case numbers dramatically yesterday, saying the state has more than 2,000 confirmed cases and a death count of 50. That would be a marked difference from the hundreds of cases and merely 12 deaths reported previously. Quote, "State Health Commissioner Christina Bach said in a Tuesday news conference that the new higher numbers don't mean that the positive cases and deaths all happened in one day. The results posted on the agency's website each day are based on when it receives data," she said. "The deaths that were reported today actually have occurred on the 14 days prior to this, from March 21st to March 30th, Bach said. Bach explained that the department doesn't report a death until there is a confirmed positive test for COVID-19. Private labs can take up to 2 weeks to report results to the Indiana State Department of Health, she said, end quote. Louisiana's confirmed cases and deaths have both spiked dramatically. Quote, "The very sobering numbers brought the state's total number of cases to 5,237, and 239 COVID-19 patients have died," Governor John Bel Edwards said at a news conference. That is an increase of 1,212 cases and 54 deaths over what the state reported on Monday. The city of New Orleans had 1,834 total cases and 101 deaths. The new data pushed up the estimated date when the New Orleans region could run out of ventilators to April 4th, and advanced the date when hospital beds in the region may be filled to April 7th, the governor said, end quote. So those are both important numbers to keep an eye on if you're looking for yardsticks of how bad things really are at the moment. And more worrying signs that spring break is a ticking time bomb set to go off around the country, quoting the Washington Post. About 70 students from the University of Texas at Austin, all in their 20s, chartered a plane to Cabo San Lucas, Mexico in late March. They took the trip despite public health advice to avoid crowding as well as non-essential air travel. On Tuesday, Austin public health officials announced that 28 students, more than a third of the young people who took the trip, had returned and tested positive for coronavirus. Many of the remaining students are under public health monitoring, according to officials. For the public officials who have repeatedly told people to stay home, the news was frustrating. Quote, "Quit being an ass," Texas House Speaker Dennis Bonin told KXAN. "Get over yourselves. Whether you think this is an issue or not, it is. Whether you think it could affect you or not, it does. The reality of it is, if I'm a college kid who's going to spring break in Mexico, you're affecting a lot of people. Grow up," end quote. China has reported a sharp increase in new coronavirus cases as they began counting asymptomatic people for the first time. More on China's numbers later in the show. A Saudi government official has asked for Muslims around the world to perhaps not attend, or at least delay attending, the Hajj, the annual pilgrimage to Islam's holiest sites that typically draws millions of Muslims to Saudi Arabia every July. The chain retailer Hobby Lobby has defied orders to remain closed and has sent a memo to store managers insisting that they reopen Hobby Lobby locations. At least 2 stores, one in Wisconsin and one in Indiana, were forcibly shut down by police officers after they attempted to reopen. Walmart has announced that it will start taking employee temperatures at all stores and distribution centers and sending workers home or having them seek medical attention if they have a fever of at least 100 degrees. Walmart is also offering masks and gloves for employees to wear. And finally, Hawaii reported its first coronavirus fatality yesterday, thereby making the state of Wyoming the only remaining U.S. state without a coronavirus-related death. The captain of the USS Theodore Roosevelt, a Nimitz-class aircraft carrier deployed to the Pacific Ocean, has pleaded with the Pentagon for resources to deal with a coronavirus outbreak on board his ship, going so far as to request that the Pentagon evacuate as much as 90% of the ship's crew. The carrier, which is currently docked in Guam, has more than 4,000 crew on board. It has been reported that more than 30 sailors have been infected with COVID-19 on board. In a 4-page letter to senior military officials, Captain Brett E. Crozier wrote, quote, "We are not at war. Sailors do not need to die. If we do not act now, we are failing to properly take care of our most trusted asset, our sailors," end quote. The captain noted that only a small number of infected crew members have been off-boarded thus far, and that the remainder on board were in conditions that made it impossible to follow social distancing guidelines and observe 14-day quarantines. Quote, "Due to a warship's inherent limitations of space, we are not doing this," he wrote. "The spread of the disease is ongoing and accelerating," end quote. The captain asked for quarantine-compliant rooms to be provided on shore for the ship's entire crew complement, quote, "as soon as possible," adding, quote, "Decisive action is required. Removing the majority of personnel from a deployed U.S. nuclear aircraft carrier and isolating them for 2 weeks may seem like an extraordinary measure, but this is a necessary risk. Keeping over 4,000 young men and women on board the TR is an unnecessary risk and breaks faith with those sailors entrusted to our care," end quote. In a statement provided to the New York Times, a Navy official said, quote, "Navy leadership is moving quickly to take all necessary measures to ensure the health and safety of the crew of the USS Theodore Roosevelt and is pursuing options to address the concerns raised by the commanding officer," end quote. So let me be clear about what the issue appears to be here. As with the discussion yesterday about military bases no longer sharing case numbers publicly, it's increasingly becoming obvious that various branches of the military are concerned, for strategic reasons, about not spreading information that indicates weaknesses in terms of our armed forces and their tactical readiness. You don't want an adversary, for example, knowing that a given military base is basically out of commission because everyone is sick, and you also don't want an adversary knowing that an entire aircraft carrier might be incapable of being militarily active because everyone is sick on board. And yet, should the realities of the situation supersede the need for such secrecy? That's a question above my pay grade. There is also a disturbing story from CNN about the Pentagon, corona capacity, and possible inaction. Quote, "Despite having committed to transferring 2,000 ventilators in military stocks to the Federal Emergency Management Agency and the Department of Health and Human Services to fight the coronavirus outbreak, the Pentagon has not shipped any of them because the agencies have not asked for them or provided a shipping location, the Pentagon's top logistics official said Tuesday. In order to ship the badly needed equipment, the Defense Department has to be given a location to send them by civilian authorities who have to decide where the items are most needed. Quote, there was discussion with HHS on where to send them, and then they said, hey, wait, we're trying to take a look at the demand that's required. And so we were asked to just wait while there was just some sorting through on that. And I won't speak on behalf of them, but we were in a position to provide 2,000, said Lieutenant General Giovanni Tuck. He emphasized there are 1,000 ventilators fully ready to be shipped as soon as the Pentagon gets a destination of where to send them. The other 1,000 can also be assembled and shipped within days of getting the order, he indicated, end quote. From further in this piece, a second worrying wrinkle, quote, additionally, it remains unclear if the Pentagon has tested any civilian patients for the virus more than 2 weeks after Esper said it had offered to do so. We are not maxing out our capacity in our labs around the world, Joint Staff Surgeon Brigadier General Paul Fredericks said at a Pentagon press conference last week, adding that the Defense Department is currently operating 16 labs capable of conducting the test. Quote, we have not received an RFA, a request for assistance from HHS that I'm aware of, he said, but we do have capacity in some of our labs. We've identified that to HHS, end quote. Several hours after the Pentagon said it had not received a request for assistance with testing, HHS told CNN it had since made an, quote, initial request for assistance from the Defense Department. Quote, HHS has submitted an initial request for assistance to DoD, and both departments are in the process of assessing the capabilities to partner on testing, the statement from HHS said, end quote. So I want to be further clear about what this article is suggesting. The U.S. military has ventilators available for use in hospitals right now, and it also has labs available right now that could increase our testing capacity nationwide. But for whatever reason, various agencies inside the Trump administration don't seem to have it together enough to simply direct those resources where they need to go. Now, a follow-up to a story we brought you last Monday. The smart thermometer company Kinza has been tracking the unusually high levels of fever across the country, likely caused by COVID-19, and new data compiled by the company suggests the social distancing and stay-at-home orders might already be working to curb the spread of the disease. Kinza's thermometers upload anonymized temperature data and location to a central database administered by the company, enabling it to track fever conditions across the U.S. in real time. Within the first day of establishing a national fever tracking map, link in the show notes, it noted a downward trend in new fevers, which suggested that lockdown measures such as restaurant and school closures and stay-at-home orders were working to slow the spread. Since then, as more and more Americans have come under stay-at-home orders, the trend has continued, quoting from the New York Times. As of noon last Wednesday, the company's live map showed fevers holding steady or dropping almost universally across the country, with two prominent exceptions. One was a broad swath of New Mexico, where the governor had issued stay-at-home orders only the day before, and in adjacent counties in southern Colorado. The second was in a ring of Louisiana parishes surrounding New Orleans, but 100 to 150 miles away from it. That presumably was caused by the outward local spread of the explosion of infections in New Orleans, which officials believe was set off by crowding during Mardi Gras. By Friday morning, fevers in every county in the country were on a downward trend, depicted in 4 shades of blue on the map. Fevers were dropping especially rapidly in the west, from Utah to California, and from Washington down to Arizona. In many western counties, the number of people reporting high fevers fell by almost 20%. The numbers were also declining rapidly in Maine. The parts of New Mexico and Colorado that had been slightly warm on Wednesday were in light blue, indicating they were cooling. So were the Louisiana counties. And as of Monday morning, more than 3/4 of the country was deep blue, a separate display of the collective national fever trend, which had spiked upward to a peak on March 17th, had fallen so far that it was actually below the band showing historical flu fever trends, which might mean that the lockdown has not only cut COVID-19 transmission, but flu transmission too, end quote. Kinza went on to tell the Times that its data indicated that the mere declaration of a state of emergency and limiting the size of social gatherings did not affect fever cases. Only once stay-at-home orders were issued and restaurants and bars were closed did the numbers they were seeing start trending downward. Coronavirus seems to be killing 13.4% of patients aged 80 or older, and 8.6% of patients in their 70s, 4% of patients in their 60s, and then it rapidly declines from there to a death rate of 0.3% for people in their 40s. New research is shedding some light on just why COVID-19 is so lethal for older people. It turns out that the age of someone's immune system, as opposed to their pure chronological age, has a huge role to play in how they respond to coronavirus infection. Scientists are developing an understanding of immunosentience, that is, how the immune system becomes less responsive with age. Physician and immunobiologist Janko Nikolic-Zugic of the University of Arizona College of Medicine calls it the twilight of immunity. Quoting from STAT, "With advancing age, the body has fewer T cells, which produce virus-fighting chemicals. By puberty, the thymus is producing tenfold fewer T cells than it did in childhood." Nikolic-Zugic said, "By age 40 or 50, there is another tenfold drop. That leaves the body depleted of T cells that have not yet been programmed to defend against a specific microbe. Fewer such native T cells means fewer able to be deployed against a never-before-seen microbe." Quote, "We just have fewer soldiers dealing with attackers we've never experienced before, like the new coronavirus," Nikolic-Zugic said. "The body does retain the memory T cells that learn to fight attackers in youth, which is why immunization against smallpox and many other viral diseases lasts decades. Another age-related change keeps T cells away from the battle. Even before T cells enter the fray, other cells recognize invaders and dispatch natural killer cells and other soldiers to destroy as many as possible in the first few hours after infection. Then these same frontline cells literally show the virus to T cells, saying in essence, 'This is the enemy. Produce virus-killing compounds.'" Quote, "But this communication doesn't work as well as we get older," Nikolic-Zugic said. "The instructor cells grow scarce and start to do the biological equivalent of mumbling. T cells therefore respond too late and too little. Antibodies are made by B cells, and their decline is less precipitous than the fall-off in T cells. But old B cells, like old factories, can't produce as much of their product, which are antibodies, as when they were new. Specifically, they have lower levels of the molecule that rearranges their genome so as to produce never-before-seen antibodies to a never-before-seen virus. As if old age weren't cruel enough, it brings one more change to the immune system. It slows down how quickly natural killer cells and other first responders hand off the defense to activated T cells and B cells. Quote, "This initial response remains in overdrive," Nikolic-Zugic said. "The core of that response is a fusillade of inflammatory molecules called cytokines. That fusillade attacks the lungs and causes acute respiratory distress syndrome, ARDS, which is a common cause of COVID-19 deaths," end quote. It's even the case that elderly men have fewer B and T cells than older women, which might also explain why older men in particular seem to be struggling to fend off COVID-19. Life feels more stressful these days. No kidding. Stores are empty, travel is on pause, work is uncertain. With social distancing now, we need support more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging across any device and hear back daily. 1 month on Talkspace costs about the same as a single in-person therapy session, but with that unlimited messaging access I just mentioned and daily engagement. No need to travel for support or wait for relief. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. We all need to talk through life's challenges, and Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use the promo code BRIEFING for $100 off your first month. My mom said to me just this week that she was sad because she can't send the grandkids care packages for St. Patrick's Day or Easter because she can't go to the post office or the shipping place anymore. I told her, and I swear I am not making this up, there is a solution, Mom. It's Stamps.com. Anything you can do at the post office, you can do via Stamps.com. Their on-demand postage means you can skip that trip to the post office, which, of course, is something we should all be doing right now, skipping any trips outside that we can avoid otherwise. With Stamps.com, you can simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier or drop it in a mailbox. It's that simple. There's no equipment to lease. There are no long-term commitments. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitments. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing at the top for your free 4-week trial. While the number of coronavirus cases in the U.S. nears 200,000, neighboring Mexico only just hit 1,000 cases, and some of its leaders are calling on Mexican President Obrador to impose tougher rules to keep the American spread of coronavirus out of their country. But why does Mexico have so few cases compared to the U.S., especially when they share one of the busiest borders in the world with over 1 million crossings per day? And when Mexico has been slow to act on the coronavirus, keeping its shops, airports, and government offices open longer than nearby nations. The Mexican government didn't even enact a stay-at-home policy until last week, and even then, many people neglected to follow it. For much of March, President Obrador was still holding rallies, shaking hands and kissing cheeks the whole time. Still, despite the high number of cases in bordering U.S. states, the Washington Post notes that one reason the spread could continue to be minimal is due to the fact that fewer people in northern Mexico travel to Europe and Asia than people in, for example, Texas and California do. That said, like many other nations, it's likely that Mexico is under testing right now, and that the actual count of cases is far higher than 1,000. And while some argue that Mexico has been slow to act, the country has implemented several initiatives following its own model born out of past experiences with infectious diseases, like being the epicenter of the 2009 swine flu outbreak. Since the first case in Mexico, authorities have been testing individuals who exhibit COVID-19 symptoms or have recently traveled to a country with known cases. When someone tests positive, authorities work to track and isolate the individual's contacts. Mexican authorities have also been tracking unusual spikes in seasonal flu cases, and as the number of cases ramped up, set up testing stations across the country. Still, Mexico has only conducted about 65 tests per million inhabitants compared to 2,250 per million in the U.S. And if the case numbers really are higher, some experts think Mexico may be experiencing a time lag as opposed to being less affected overall. Mexico didn't report their first coronavirus case until February 27th, a month after the first case was reported in the U.S. And if Mexico is simply further back on the timeline and will eventually catch up to the U.S., there's a big reason to worry, quoting the Washington Post. If it turns out Mexico waited too long to introduce restrictions, analysts warn, it could suffer a crisis like Italy's or New York's with far fewer resources. Mexico has half as many hospital beds per capita as the United States and a quarter as many nurses, according to statistics from the Organization for Economic Cooperation and Development, end quote. So doing whatever they can to flatten the curve, including limiting border crossings, as many state and local officials have called for, could make a huge difference in the long run. And finally, remember how I was saying that a lot of people are coming to doubt the official Chinese death numbers from coronavirus? Well, Radio Free Asia has some pretty specific speculation on all of that. Now that the lockdown in Wuhan has lifted, people are starting to see signs that the 2,500 estimated death toll in that city might be less than accurate, quoting Radio Free Asia. Since the start of the week, 7 large funeral homes in Wuhan have been handing out the cremated remains of around 500 people to their families every day, suggesting that far more people died than ever made the official statistics, end quote. News site Kaksin reported that 5,000 urns had been delivered to Hankow Funeral Home in just one day, and social media posts estimate that 7 major funeral homes in Wuhan have been handing out 3,500 urns a day as well. Plugging those numbers into the communication from funeral homes to families that they will complete cremations before the King Ming Grave Tending Festival on April 5th gives an estimate of 42,000 urns handed out in a 12-day time period, according to some online. Quoting Radio Free Asia, another popular estimate is based on the cremation capacity of the funeral homes, which run a total of 84 furnaces, with a capacity over 24 hours of 1,500 urns citywide, assuming that one cremation takes 1 hour. This calculation results in an estimated 46,800 deaths, end quote. One guess for why the reported numbers are so low is that many people died at home without ever having been officially diagnosed with coronavirus. Some are also speculating that there are less innocent reasons for the disparity in numbers. Wuhan resident Chen Yuhai told Radio Free Asia, quote, "There have been a lot of funerals in the past few days, and the authorities are handing out 3,000 yuan in hush money to families who get their loved ones' remains laid to rest ahead of King Ming," end quote. Regardless of the reasoning of the alleged disparity in reported cases, Chen says that most people in Wuhan are skeptical themselves. Before the pandemic, crematoriums were cremating about 220 people a day. During the pandemic, workers were brought in from across the nation to keep the crematoriums going all day and night. A Wuhan resident told Radio Free Asia that if they were operating all day and night, the 7 crematoriums alone would have capacity of 2,000 bodies in a single day. Again, the official number for Wuhan throughout the course of the entire virus is just 2,500 in total. So it's still a lot of speculation, but that is a huge gap between the reported numbers and these estimates, 2,500 versus upwards of 40,000. If even part of these estimates turn out to be true, then that means we're looking at far starker numbers than originally believed. I feel like that story about the Pentagon having supplies, but no one is telling them where to send it all, is maybe a story that is getting swept under the carpet among the deluge of other headlines, so might be worth us all shouting that story from the rooftops in the hopes of spurring some action somewhere. Nothing would be more tragic than having supplies at this moment that are going unused for no good reason. This show was produced by Ride Home Media, and as always, we appreciate you telling your friends and family about this show, as well as your continued listening and support for this show. Talk to you tomorrow. Be well.